Hello everyone, welcome back to my channel. Today's topic is for third year in topic medical surgical nursing. I am going to explain about investigations related to eye disorder. This is the part 1. Some of the investigations are explained in this video and rest of them will be explained in part 2 video. So let's move ahead. The investigation procedures that I am going to explain in this video is about pupil function test, visual field testing, and slit lamp examination. Let's move forward. Pupil function test. So, pupil function test is examination of pupil function. That examination includes pupil size, regularity, shape, reaction to light, and consensual recommendation. So in pupil function test, we determine whether pupil has whether both of the pupil of both eyes has equal size, regular shape, and reactivity to light. Talking about function of pupil, the pupil constrict during illumination and dilate during dark. That means pupil constricts, become smaller in size during light and become larger in size, a bit larger in size during dark. Normal pupil size in adults is 2 to 4 millimeter in diameter during light and 4 to 8 millimeter in dark. As in dark there is dilation and as in light there is constriction. Purpose of performing this investigation is to determine whether appearance of pupil is normal or not. If we go back to introduction part, there is equal size, regularity in shape. So purpose is to determine whether appearance of pupil is normal or not, shape size of pupil is normal or not. Another purpose is to monitor the functions of pupil. Functions of pupil like constriction, dilation, and other functions are occurring properly or not. That is the second purpose. Indication. Patient who need this test. Indications are patients suffering from optic neuritis, optic nerve damage, optic nerve tumor, and retinal infection. Next part is role of nurse. There is role of nurse during the procedure, but we can divide it in before the procedure and after the procedure. Before the procedure, first of all, nurse should obtain consent, both in written and verbal form, explain the procedure, explain each step of the procedure so that patient can feel comfortable. Next is, nurse should prepare herself by washing hands and arranging all the equipments on time, even before the patient arrives. Next is preparation of patient. Preparation of patient should be done by maintaining correct position for the procedure and allaying anxiety of the patient, communicating to remove the anxiety of the patient. Next is preparation of environment. Environment is the place where the procedure is going to be performed. Preparation of environment can be done by placing adequate light and providing comfort to the patient. While after the procedure, what nurse should do is, first of all, make the patient comfortable again just after the procedure, record each and every event that happened during the procedure, and make a conclusion, conclusion of the finding of that procedure. The nurse should explain the procedure to the patient first in a simple language, simple and understandable language. Nurse should try not to use too many medical terms that layman cannot understand, patient cannot understand. She should use simple words and explain the procedure, explain the findings of the procedure to the patient. We have a mnemonics for this test. Mnemonics like PERRLA, perla. Full form is pupil equal and round, reactive to light, and accommodation. For this test, this mnemonics can be used while writing an exam. Next test is visual field testing. Field of our vision. Extent of field of our vision. So visual field testing is examination of both eyes separately to assess the extent of peripheral field. to determine up to what distance patient can see clearly, correctly. To perform this test, examiner occludes one eye, occludes is closing, closes one eye and fixes the non-occluded eye, opened eye. Then the patient is asked to count any object or number of fingers that are flashed in each of the four quadrants. Patient is shown a diagram and patient is asked to count the number or whatever is there, whatever diagram is there. Purpose of performing visual field testing is to assess peripheral vision, to assess the extent or distance up to which patient's vision is clear and the distance from which patient vision is not clear. The distance might be nearby or far, but it needs to be measured. Next purpose is to monitor the vision after treatment. This means if patient has undergone any kind of surgery related to eye, then after that surgery, it is necessary to monitor the vision of the patient. Indications of this test is visual field deficit, vision loss, headache and neurological deficit. Again, role of nurse. How can nurse participate in this procedure? Before the procedure, nurse should obtain consent, explain the procedure, and make the patient comfortable during the test. Preparation of nurse herself can be hand washing and arranging all the articles needed for the test. Preparation of patient can be by maintaining correct position. For this procedure, orthopnic or sitting position is the correct position and allaying anxiety of the patient. Next is preparation of environment. Nurse can prepare environment by providing adequate lighting in that room, in that examination room, because patient has to visualize something and answer the question asked by the nurse. So nurse should make sure that that room has enough lighting so that patient can see whatever nurse shows to the patient. And after the procedure, again, making the patient comfortable is the first priority. After that, recording each and every event that occurred during procedure and making a report of findings of that procedure. After that, explaining the findings to patient, explaining in a simple language so that patient can understand what is his condition. Patient can understand about its condition, and also patient can understand how to start treating the condition. So explanation should be simple as much as possible. Next is the last investigation procedure for this video is slit lamp examination. Slit lamp examination is process of inspecting the anterior parts of eye structures using a slit lamp. Slit lamp is a table mounted with microscope with attached source of illuminating light adjusted to it. The light beam is passed over the eye. From that slit lamp, light beam is passed over the eye during examination. The examiner views illuminated ocular structure, that is lighted ocular structure that magnifies the image of the eye, that shows each and every part of the eye correctly. Diagram of slit lamp I will place at the last of investigation procedure video. Diagram of every test I will place at the last, that is in part 2 video. And I will explain, I will again as a revision explain a little about every procedure. For now, this is a description only. Light beam is passed over the eye, and through that light beam, what we can see is that light beam shows us every part of the eye microscopically, clearly. Purpose of slit lamp examination is to detect any detachments in retina, any detachment of the cells of the retina, to find out any tear or cut, if there is any tear or cut, and to find out damage to optic nerve, to find out whether the part that carries the nerve towards the brain or that receives the nerve from the brain is damaged or not. The indications for this procedure are glaucoma, retinal detachment, dry eye syndrome, and cataract. There is a contraindication for this procedure, that is recent eye surgery. Any person who has just undergone recent eye surgery, it is not safe to perform this procedure on that patient. Now, role of the nurse. Role of nurse for a slit lamp examination before the procedure is, first of all, obtaining consent, of course, explaining about procedure, steps of the procedure, explaining the patient that light source will be exposed in their eyes. They might feel a slight discomfort, but it will be for a short while, and then whatever problem is there can be found out. Next preparation is preparation of nurse, same thing, hand washing and arranging the equipments. Preparation of patient by maintaining correct position and trying to allay anxiety of the patient. Preparation of environment can be by adequate lighting and providing comfort to the patient throughout the procedure. Patient sit comfortably during this examination with head stabilized in adjustable chin rest near the slit lamp. So the slit lamp is a device designed in such a way that chin can rest and eyes can be exposed towards that light. After the procedure, the nurse first of all makes the patient comfortable, records all the events during the procedure, starting from the beginning till the end, and make a report about findings of that procedure. Again, nurse explains the finding to the patient in an understandable language so that patient can comprehend about his or her condition. These were the 3 diagnostic procedures. Next procedures will be continued in next video. Thank you so much for watching. Wait for next video.